Not every blocked fallopian tube needs surgery, and not every case can be treated naturally either. The key is knowing where you fall, because when it comes to treatment, it's not about trying everything. It's about choosing the right approach based on the cause and severity. Therefore, in this video, we're going to be learning the medical treatment and the natural approach that we can use to treat blocked fallopian tubes, depending on the causes. If this interests you, I urge you to watch this video to the end so that you can learn about these approaches in order to pick what fits you more. Hello and welcome to today's video. My name is Pharmacist Ngozi. I teach about health issues, particularly fertility, teaching you ways that you can improve your fertility and carry your own baby. In my last video, I discussed about causes of blocked fallopian tubes. In today's topic, we are going to be talking about the diagnosis, medical treatment, and also natural ways that fallopian tube can be treated. Let's go straight into the topic. Most times, blocked fallopian tube does not give any symptoms. There's no symptoms associated with blocked fallopian tube, except the woman starts trying to conceive and is unable to conceive. But then there are several diagnostic procedures that can be used to find out if someone has blocked fallopian tubes or not. Number one is hysterosalpingography, commonly known as HSG. This procedure usually uses an X-ray and a contrast medium, which most times is iodine, to check the uterus and the fallopian tube for any blockades. In this procedure, a thin tube is inserted to the vagina into the uterus. After the procedure, the doctor examines the X-ray to know if there is any blockade of the fallopian tube. The second diagnostic procedure is called sonohysterography. This is a special ultrasound examination where fluid is put into the uterus and into the fallopian tubes. Using sound wave through the ultrasound, the image of the uterus is graded. This grades more detailed image of the fallopian tube, more than the HSG. The third procedure is called chromotubation. It is similar to HSG. It involves injecting a contrast medium or dye into the fallopian tubes, usually indigo carmine or methylene blue. This procedure is usually done with a laparoscopy and usually may require using anesthesia. Number fourth procedure is called hysterocontrast sonography, and this is less invasive than chromotubation. It involves the use of contrast agents and transvaginal ultrasound rather than laparoscopy to detect abnormalities in the fallopian tubes. So let's look at the medical treatment for blocked fallopian tubes. Some women with blocked fallopian tubes may undergo surgical procedures to remove the blockade. For small adhesions, doctors may recommend laparoscopy in order to open up the tube. I'm going to be listing medical surgical procedures that can be used to treat blocked fallopian tubes, and they include selective tubal cannulation, salpingotomy, fimbrioblast to repair damaged fimbriae, cases of clumped fimbriae due to scarring, and then salpingostomy. So these are medical procedures that are used to repair damaged fallopian tubes. Of course, there are many risks and concerns when it comes to surgical repair of the fallopian tubes. Pregnancy success after these procedures are also not always granted. There can be issues of scar tissue regrowth or adhesions, ectopic pregnancy, risk of infections, and so on. So these are some of the risks involved. Now let's look at the natural approaches that we can use in support or treatment of blocked fallopian tubes, which involves some lifestyle modifications that you can adopt that will help improve the health of the fallopian tubes. Number one is adequate hydration. Just like I discussed in the causes of blocked fallopian tube, that when the mucus of the fallopian tube is too thick, the egg will find it difficult to swim, and even the sperm cannot move freely through it. Therefore, adequate hydration is very, very important to ensure that there is normal amount and consistency of the mucus in the fallopian tube. Number two is checking your medications with your pharmacist, especially when you are approaching your ovulation, to ensure that they are not such that can increase the mucus production too much that they'll become a problem, or dry too much that movement of egg or sperm will be difficult in the fallopian tube. Number three is the use of castor oil pads. There's no much research scientific data on this, but there's been testimonies from naturopaths that this kind of treatment can improve circulation of the blood in the reproductive system and also help in the movement of the lymphatic system in the reproductive organs. Some benefits of using castor oil packs include improved circulation, lymphatic support, and pelvic stagnation relief. How is this castor oil pack used? If you want to give it a try, just get a cotton cloth, soak it in castor oil. Place the cloth that you have soaked in the castor oil on your belly below your navel. Then use another cloth to cover it to prevent burn. Get a hot water bottle, fill it with hot water, lie down there. Place the hot water bottle on the cloth that you have placed on top of the cloth soaked with castor oil. Hope it makes sense. And then allow it to stay like that for some time. It helps generally with the female reproductive health, including the ovarian, the uterine, and the fallopian tubes. So you can give it a try and see if it works for you. Number 4 is quitting smoking. Already it has been established that smoking leads to the paralysis of the cilia or the fallopian tubes. And apart from that, there have been studies showing that smoking leads to primary tubal infertility. Therefore, quitting smoking is one of the best ways to improve the function of the fallopian tubes. Number 5 is quitting excessive consumption of caffeine. This is because caffeine leads to dehydration, which leads to thicker mucus, slowing both the cilia and egg movements through the fallopian tube. Number 5 is quitting alcohol consumption. There's been a lot of research evidences showing that alcohol can reduce the activity of the fallopian tubes. Just like excessive consumption of caffeine can affect the fallopian tube, so also is excessive consumption of alcohol. And generally, it's not advised that anyone trying for pregnancy be indulged in alcohol. Alcohol consumption also suppresses the spontaneous movement of the fallopian tube. Number 6 is eating more garlic to naturally prevent bacterial infections. Knowing fully well that pelvic inflammatory disease and other infections like chlamydia can affect the fallopian tubes, causing scarring and adhesions that may eventually lead to blockade of the fallopian tube. The antibacterial activity of garlic can help to prevent this from happening. So if you have been watching my video and you like my content, please don't just watch, kindly click the subscribe button to subscribe to this channel. Number 7 is exercise. Regular moderate exercise is important in order to improve circulation and get the lymph moving, and this is also one of the ways that you can improve the health of the fallopian tubes. Number 8 is getting an abdominal massage. Abdominal massage, often referred to as fertility massage, is often used as a complementary, non-invasive approach to support reproductive health, particularly in addressing fallopian tube blockade due to scarring and adhesions. So there are specialized massage techniques that can be used in this case to help break fibrous adhesions that may be causing the blockade of the fallopian tube. The massage generally increases blood circulation to the reproductive organs, which helps to bring fresh oxygenated blood to the tissues and help to remove toxins. In fact, a 10-year study on manual physical therapy, that is a specialized form of abdominal work, showed a 60.85% success rate in opening blocked fallopian tubes. But then it's important to consult a certified fertility massage therapist to do this for you or to guide you before you can go ahead to do this abdominal fertility massage. Again, timing is important. It's advised this massage is performed before ovulation, then to stop if you think that you are pregnant. Number 9 is to practice visualization. What does it mean? That is visualizing your fallopian tube clear and open and fertilized egg rolling down through the fallopian tubes into the uterus. You can do that morning and night. Most times the universe knows how to bring our fiction into reality. Number 10 is taking enzymes like serapeptase. These systemic enzymes aid the immune system in removing adhesions and scar tissue, not just in the reproductive system but even elsewhere in the body. There are also easily accessible herbs that you can incorporate into your meals that can reduce inflammation and may help in reducing too much mucus or excessive mucus production in the fallopian tubes. They include turmeric, ginger, cinnamon. They are similar to the ingredients used in making spicy fertility tea. So you can make them as tea and consume, or incorporate them in your meals when you are cooking. With this, I've come to the end of today's video. If you have not watched the video I made on causes of blocked fallopian tube, click the next video to watch it.